A very good afternoon to all of you. I am Dr. Vidya Shah, Director, EPILO Health Systems. On the behalf of Voice of Healthcare today, I would like to welcome all the attendees and the guest speakers. The topic for today's discussion is tackling dengue. Dengue is the most common arboviral disease in the tropical and subtropical parts of the world. Dengue endemic areas have faced an additional public health and socioeconomic impact due to the ongoing coronavirus pandemic. Rise in dengue COVID co-infection is becoming a major public health concern and have been reported with complicated patient management and care requirements. So let us understand more about this situation from the experts we have with us today and how can we overcome it. So today we have a wonderful panel with us. So let me introduce you to Professor Dr. R.M. Chabra. He is consultant physician, Max Hospital, Shalimar Bagh, and governing member, Association of Physicians of India. Dr. Prabhat Ranjan, he is Senior Consultant and Unit Head, Internal Medicine, Akash Healthcare Super Specialty Hospital. And we have Dr. Shalini Joshi, who is Senior Consultant, Internal Medicine, Fortis Hospital, Bangalore. And in few minutes, we'll be having Dr. M. Wali joining us, who is Senior Consultant Physician, Sir Gangaram Hospital. Sir, a very warm welcome to all of you.
Thank you.
So meanwhile, I would like to start the session with Dr. R.M. Chabra.
Yeah.
Almost
Thank you.
half of the world's population, around 4 billion people, live in the areas with the risk of dengue. Dr. R.M. Chabra, I would like you to share about the risk factors and the causes associated with dengue. Over to you, sir.
Thank you, Ruby. And first of all, I would like to thank you, Voice of Healthcare, for giving me this opportunity. As you know, we are already suffering and facing the big problem that is COVID-19 pandemic since last 2.5 years. Dengue, no doubt, we have been suffering from the dengue more than decade in the India. But if it occurs with the COVID-19, it becomes so difficult to treat, to prevent, to treat. No, both are the viral disease. We have to tackle the two viruses for this. As of now, there is no treatment at all. We have to prevent both the disease, COVID as well as the dengue. So to tackle with the dengue, we will discuss and how we will treat the patient who is suffering from the double infection, that is the dengue as well as the COVID-19. So we would like to ask the Dr. Ruby to start the discussion or the panel discussion or the dengue, how to tackle the dengue in this pandemic, COVID-19 pandemic era. Dr. Ruby, please.
Before that, sir, I would like you to discuss about the risk factors and symptoms associated with dengue.
The risk factor, as you know, the dengue is a viral disease. It is borne by the vector, that is the mosquito. That is Egyptian mosquito that is breeding. All the mosquito are breeding on the clear water. Have you seen? The dengue is more in the urban area because the dengue breeds on the clear water, either AC water or stagnation water. Wherever the clean water is there, then definitely dengue will be there. The risk factor, you have to clean the things, either cooler water, and you have to change the water regularly. As you see, the Delhi government, after 10 days, every water should be changed, the either cooler, or there should not be any stagnation of the water anywhere. So if we do another, what we can do at the vector side, so we can use the repellent or the chemical, biological, and the other prevention. The chemical, we have to use the spray like the insecticide. We have to kill all the mosquito around us so that dengue cannot be occur. You know, the dengue mostly bite at the time in the daytime. It bites below the knee or below the hand. If you are sitting, then it will bite definitely. So we have to protect ourselves by using the full sleeves shirts and the pants we have to use the socks, and we have to wear the suits so that the mosquito cannot bite you. If a mosquito cannot bite you, then definitely dengue will be not be there. Another is the chemical. You have to change the water frequently. Another insecticide or the repellent. You should use the good night and all that, so that the mosquito cannot come to you in the contact. These are the factors you can save yourself from the dengue infection.
All right, sir. Thanks a lot for this information. And now I would like to bring in Dr. Prabhat Ranjan. So, sir, could you please tell us a little more about the stages of dengue where it could turn fatal?
See, dengue, as you said rightly, uh, it's a viral, arboviral disease, and it has got many stages. The classical form of dengue fever, the classical dengue fever, it could be second form is called dengue hemorrhagic fever, and third is called dengue hemorrhagic fever with shock. So these are the three stages of the disease. The normal classical dengue fever can be very well managed at home, where the patient has the symptoms of fever running for 2 to 5 days, high grade fever, prostration, lot of headache, body ache. All you need to give the patient the antipyretics, simple paracetamol. Along with that, you have to maintain the hydration. Patient should take rest, and all the symptomatic medication. Patient becomes all right. Then comes the second stage, that is the stage of dengue hemorrhagic fever. Patient, because we all know that it causes the less of the platelets count, so patient have the hemorrhagic manifestations in the form of epistaxis, I mean the bleeding from the nose, the gum bleeding, or for that matter, blood coming out with the urine, or with the cough, hematuria and the hemopsis, as we call in our medical terms. So these are the symptoms, hemorrhagic symptoms, or more deadly bleeding manifestation could be like intracranial hemorrhage, bleeding, brain hemorrhage, which we can say in the simpler words, or some intra-abdominal bleedings. So these are the hemorrhagic manifestation, and patient in this condition definitely needs to be hospitalized, needs the hospitalization. Third stage is there, since the dengue is causing high grade fever and it causes the vasodilation, so the natural tendency will be the blood pressure falling down. In that condition, if blood pressure systolic is going less than 90, we call it hypotension and shock. So in that condition also the patient needs to be hospitalized and treated, managed accordingly and adequately. Because these upper two conditions, as we mentioned, the dengue hemorrhagic fever as well as the dengue hemorrhagic fever with shock is a kind of emergency and should be hospitalized. So these are the common stages of dengue fever. Over to you.
Okay, sir. Thanks a lot, sir. So, switching over to Dr. Shalini Joshi. Ma'am, could you please walk us through the existing strategies in response planning to the dengue outbreak?
So basically, as Dr. Chabra and Dr. Prabhat said, that it is a quite, severe disease. If the patient presents late, but there is a whole spectrum, mild to severe. But all said and done, the number of patients who get infected, it can really put a stress on the healthcare services, and it results in massive economic losses and strains the healthcare. And we know that, as mentioned by the previous speaker, we don't have antiviral therapy. And there is always, we've been waiting for a dengue vaccine. Many of them are in the process. There is only one which has been used in South America, but it is not licensed in India. Well, for the vaccine would be a very a desirable prevention control strategy for dengue, because, as you said, half of the population, especially in Southeast Asia, is at risk for dengue. So after treating, patient is infected, like we are doing with COVID-19, vaccination is the. But the problem is, there's a very unique and complex immunopathology of dengue, which has complicated vaccine development. Plus, there is a lack of animal models for this disease. There's absence of suitable markers of protective immunity. So these are few challenges which medical community has been facing to in the development of dengue. All said and done, there are almost phase 2, 3 trial phases of vaccine development are in process. So hopefully, we will get a vaccine. So till then, we have to do vector control, which can be done at 5 stages. So what you can do on a personal level, Dr. Chabra elucidated very nicely that in urban areas or in rural areas as well, anything on a personal level, you have to make sure that there is no stagnant water around you. It could be just as simple as draining your some kind of pots, pans which are lying around in your balcony. People are living in apartments. Next comes at your association level. Everybody's living in apartments. So as an association, you can find that, make sure in a habit you're not, flowering lotuses and all these, water-based water bodies are taken care around you. I mean, I live in Bangalore. There are many, many water bodies, or you can call it ponds or lakes. And with monsoon season, and that is also a late monsoon and very heavy torrential rains, I'm sure all across South India. But as we see this year, North India is more affected as compared to South India. So at a rural level, there are ASHA workers, there are assistants which are involved in more surveillance at a state level. There are measures taken care of, fuming. There are some vector control methods which are environmentally friendly, safe, which are, have you seen the guppy fish? The guppy fish has been released in Tamil Nadu and few other states, which actually are there's no use of chemicals, so they eat that larva stage, which is have been quite effective. And there is one fish called gambusia fish is also very useful. So we don't have to spray chemicals in the ponds and water bodies. So it's a good way of vector control. Then definitely using mosquito nets at home and the repellents on your personal basis at a national level. So we've gone to individual, then we've gone to rural, then we've gone to urban. Then at a national level, we definitely have been experiencing a massive movement called Swachh Bharat. So Swachh Bharat, so lot of the piles of garbage and domestic waste, which can become a breeding place, which collects water, also has given good results. And this is an ongoing process we have to keep doing, and this is a public has to participate as such, as is the government duty. And at the international level, WHO definitely is working very hard, and they've set up policies and guidelines to have more surveillance body, how to how to prevent and how to predict such outbreaks. That would be very helpful in taking care, so that if there is a better surveillance programs, there will be preparedness. Let's say in severe dengue, we need to give platelet transfusion back. That is the only option in severe cases. So we should have ample amounts of blood. People who donate blood, or the blood banks are equipped. So that would be my input on the strategies for prevention of dengue.
Thanks, Dr. Shalini. That was a lot of useful information about the vector control methods and transmission control of the virus. So I would like to bring in back Dr. RM Chabra. Sir, what are the other treatment options available for dengue? And as Dr. Shalini discussed, that developing an effective vaccine against dengue is really challenging. Could you please enlighten us more about the same?
Yes,
And the
Dr. Shalini has told you about the prevention part. Then I can treat. As of today, there is no specific treatment for the dengue because it is a viral disease. Everybody knows no antiviral is there. Antibiotic is not useful because it is a viral disease. No antibiotic is there. Only symptomatic treatment is there. You have to treat the patient asymptomatically, specifically for the hydration. Very, very important, hydration and nutrition. You should hydrate the patient in proper way so that the complication will not occur. If there is a dehydration, definitely kidney will go. Another other complication will occur if you are not treating the patient properly. If infection occurs, superadded with infection, patient is suffering from the dengue. If there is an infection anywhere in the body, then you have to give the antibiotic antibiotic according to the culture or the sensitivity, which antibiotic you want to give. The prevention part, sportive treatment is the only answer for the dengue. No specific treatment as of now.
All right, sir. And sir, also I would like to understand the role and effectiveness of platelet transfusion in the management of dengue from you.
Yes, definitely. That is a no treatment. This is a sportive treatment. If the platelets go down below the 20,000, there is a bleeding. Or the 50,000, there is a bleeding. Definitely, if thrombocytopenia is there, then you have to infuse the plasmapheresis. You have to give the concentrated plasma or the other plasmapheresis. You have to give. That is the sportive treatment. If there is a thrombocytopenia, definitely you have to give the thrombocyte. That is no treatment. That is the sportive treatment. Because the thrombocyte is there is a bleeding. The patient, if he don't infuse the platelet, definitely the bleeding will occur. Then patient may die. If there is a hemorrhagic fever, then you have to treat accordingly. According treatment and the sportive treatment is required in the dengue.
Okay. And do you have to say something about the vaccine development and advances for the dengue treatment?
No doubt. There is no vaccine as of today. Only one vaccine is there, that is a dengue vaccine. That is approved in 2015. That has been given to the 9 to 16 years old person. But it should be given to those people who has already suffered from the dengue, not to the other patients which are not suffering. And they are living in the endemic area, in the dengue fever. Then you can give the vaccine. As of now, there is no vaccine. It is a tetravalent vaccine against the dengue that is manufactured by the Sanofi people, and it is not approved anywhere. No other. Only vaccine is the dengue vaccine. At present, there is no vaccine for the dengue, for the prevention purpose.
All right. Thanks a lot, sir. And now I would like to bring in Dr. Prabhat Ranjan again. Sir, what are the clinical features and health outcomes of COVID-19 and dengue co-infection? As both these infections show overlapping clinical and laboratory features. So what do you have to say about it?
That's a very nice question, actually. We can see a lot of these cases has been reported world over, and recently from the Punjab also, few cases of COVID-19 infection along with the dengue patients dengue cases has been reported from there also. See, dengue plus COVID, they have many of the symptoms in common. Like patient will have the fever, the shortness of breath, the cough, the generalized weakness part, the dehydration part. Those all symptoms are very overlapping on each other. So you definitely need a high degree of suspicion about this. As far as the normal laboratory parameters are concerned, what you see, the thrombocytopenia, the leukopenia, the lymphocytopenia, we see in both the cases. It can happen in the COVID as well as in the dengue cases also. So the only differentiating way which will going to help us is the serological parameter, serological test. We have to differentiate on the value of on the basis of the serological test. Like for dengue, we have to go for the dengue ELISA, IgM, IgG, which will tell us about the acute as well as the chronic infection if the patient had any in the past. For the COVID-19, we have again got the antigen, then the RT-PCR, the TrueNet test. So looking at that, if we still come along like the co-infection of that, co-infection in those group of patients, we have to treat, we have to be very cautious and treat it very carefully, because many of the medicines which we use in the COVID-19 infections are absolutely contraindicated in dengue. So a clinician has to walk a very tight line, and the patient need to be very, very carefully scrutinized and very carefully followed. And definitely, the patient becomes sick, which needs the ventilatory support, and all those hypotension is coming up because of that. So the symptomatic medications would be given, and the patient should be followed case by case. It should not be like a blanket treatment. It should be given to all. It should vary from the case to case. Thank you.
Dr. Ruby, Dr. Prabhakar, sometimes the patient is suffering from the COVID, I think you maybe agree with me. There may be false positive of the dengue because there is a cross antigenicity, say similar. Then there may be a false positive of the dengue. We have to clinically correlate with the dengue fever. Am I right, Dr. Prabhakar?
Because whenever some antigen or some viral infection is introduced to the body, there is a plethora of antibodies. So
Yeah.
we very commonly what we see when we come across a patient of dengue, we see the typhoid.IgM or other tests coming out to be positive, or for that matter,
Yeah.
Bill's Phillips will also come as positive. So the
Yeah.
same thing happens with the COVID co-infection also along with the dengue. So
Yeah.
that's quite natural. You have to be very specific. That is why I said you have to be very. You need a very sound anticipation about this.
Yes,
Don't
definitely.
of suspicion should be needed in the cases like
And
this.
clinical correlation is also. Yes, you are right.
Thank you, Dr. R.M. Chhabra and Prabhat Ranjan. And now I would like to switch to Dr. Shalini Joshi. Ma'am, what do you have to say about the preventable practices in mitigating or lowering down the risk of dengue and COVID co-infection?
So basically, the thing with COVID-19, I think we have been stressing enough for last 18 months. No, all said and done, let's talk about COVID-19 and co-infection definitely. COVID-19, one thing I would like to say, people get worried about this COVID-19, then Delta variant, then Omicron variant now. See, the thing is the mask is very good. It doesn't differentiate what variant it is. If you wear the mask, you will be safe. It's not that we have to wear some other mask. It is क्या बोलते हैं हिंदी में, आई एम नॉट गेटिंग द राइट वर्ड. वो किसी से भेदभाव नहीं करता, वो मास्क आपको हर एक चीज से बचाएगा. सो फर्स्ट थिंग इज द मास्क. ओके, व्हाट मतलब इसको इतना ज्यादा स्ट्रेस करना चाहिए क्योंकि because people wear mask, but some I've seen people wearing N95 mask for 10 days continuously. It is soggy. People are washing surgical masks with soap and water, or they're wearing the cloth mask this side, then they forget, then they turn it inside, then they wear it. So it is very, so how to wear a mask is another science. And not touch the mask from outside. I've seen so many people, they will touch, do like this. First of all, this is not the way to touch the mask. You have to do the string, okay, and then you have to wear it. Where is my mask? Okay,
Yeah,
here.
ma'am, if you could give us a
So
demo.
Very
basically,
important information.
we see so many TV personalities or people who are reporter who are giving 1 hour talk how to wear a mask, and then they themselves do it like this. This is wrong way. Okay, you have to do it like this. Basically, you can wear it like this, and then you can wear it like this. And when you have to remove it, you have to remove like this.
Yes.
To remove like this, strings, never with the mask. Okay, so one thing. Number two, social distancing. I know it's not possible in India, but at least when you're going to any crowded place, try to do it. But mask is very important, and sanitization. When you're at home, soap and water. When you're outside, sanitizer. I've seen parents giving sanitizer like a amrit to the kids. It destroys the your biofilm, your good bacteria on the hand. So at home, soap and water. Outside, if you don't have access, sanitizer. And definitely, as you know, that monsoon season is on top of us, and it's been extended monsoon. Actually, for us, it's been drizzling, raining in Bangalore for last 2 weeks. We have not seen the sun only the last 2 weeks. So it is giving rise to more and more dengue cases, but definitely not as bad as in North India this time. So for dengue, definitely, like Dr. Chabra had elaborately described, you have for children, when they go to play areas, first they were inbound by the mothers, very scared. Now they are going outside. So make sure at least kids wearing full sleeves pants and some kind of mosquito repellent should be used. So definitely it's a very challenging time if a person with high fever comes. First of all, the patient should come. The problem here is sometimes there's so much of WhatsApp university. People themselves will think that, oh, I think I have dengue, or maybe I have this thing. They will treat by consulting the WhatsApp, their neighbors and their friends. So that is absolutely not a good idea in these times, because as Dr. Chabra mentioned, and Dr. Prabhat mentioned, that the treatment is very different. You can end up into trouble. So there is possibility of co-infection, but the mask will prevent you most of the time. And believe me, we have been using very diligently, and the core team in our hospital, touch wood, nobody got dengue, who is treating COVID patients. So similarly for dengue, if until we have better, until we have the vaccine and we have to ramp up our vector control methods, prevention, like we say in real estate, location. Okay, so it is prevention. That's the best strategy. And I think at the center and individual states are doing a fantastic job, at least putting out the message. We just have to reiterate it, emphasize it, and change people behavior. So the mask is not to avoid the fine, it is for you. Like the helmet is not to avoid the fine, it is for your head.
For your own safety.
Dr. Ruby, I would like to. Dr. Shalini has explained in very, very apt method. Awareness is very important. I will say, if you are leaving your house, you must remember the SMS. S means social distancing, M means mask, third is the sanitization. और अपने प्रधानमंत्री जी कह रहे हैं, अमिताभ बच्चन जी कह रहे हैं, जब तक कोई दवाई नहीं, जब तक कोई ढिलाई नहीं. ये आपको स्लोगन याद रखना चाहिए. ये दो इंपॉर्टेंट चीजें प्रिवेंशन के लिए बताऊंगा आपको मैं. I will tell you.
और SMS का एक और मतलब है सवाई मानसिंह मेडिकल कॉलेज, and I am from SMS.
Oh, I am from Bikaner. My wife is from SMS.
Okay. So that was a lot of useful information, and the demonstration of how to wear a mask by Dr. Shalini Joshi. I'm sure it will become handy to a lot of us. Thank you, ma'am. And coming back to Dr. Prabhat Ranjan, sir, as we can see around that the current pandemic has turned everyone's attentions towards the use of nutraceuticals in improving immunity. And there has been a lot of growing interest for various disease management by the use of nutraceuticals. So what do you have to say about it? And are there any solutions available for dengue and COVID co-infection in this industry?
Ma'am, see, there are few products, they come as like papaya leaves. We still, one study came some 4 or 5 years back from Malaysia or somewhere. We say that if you use the papaya leaves, it increases the platelets count. Whether it acts or not, it is still not finalized because many of the RCT has not proven it clearly. Similarly, thing happens with the nutraceuticals thing, that whether it increases the immunity or not. What is the parameter in that? Whether it avoid the infection, whether it treats the infection or not. Proper research has to be there before we conclude finally that these are working or not working. So still in the early phases, I do come across the patient who are taking some 10 or 12 nutraceuticals products in order to avoid the infection, especially in the beginning when there was a havoc, then there was a people were scared about the COVID infection. Take this, take that, take this, take that. So many things were going on. But seriously, after we came to know that, okay, he tried his level best to prevent it, still it got out to get that, caught that infection, COVID-19. So still I'll say the best part, as said by both of our other panelists, that the prevention is the best thing. And the role here comes, if you have a balanced diet, you hardly need, say, pharmaceutical, nutraceutical things.
Right. Thank you, Dr. Prabhat.
Dr. Ruby, Dr. Ruby, I would add, Dr. Prabhat has rightly said, it should be used unless until it is evidence-based. Because we are the allopathic doctor, we should use the things on the evidence-based medicines. But all the medicine come from the either plants or the antibiotic from the bacteria. All the medicine come from that. If the other medicine, the homeopathic or the Ayurvedic, these are very useful medicine. If it is increasing, then you should use by them. But unless and we cannot use the medicine without the evidence base because we are the allopathy doctor. Nothing is ये बेकार है वो हम नहीं कहना चाहते, लेकिन अगर उससे evidence based है तो one we should use it. Evidence based नहीं है तो being a allopathy doctor we cannot use it. Am I right, Dr. Prabhat?
Right, sir. So, the time has come that we should stick to evidence-based
Yes.
medicine.
Because the legal problem. Yes.
Right.
So I would also like to add, I'm sure everybody in our hospital, the relatives of the patients would be very adamant to give the papaya leaf juice, because if you are, but we know as in the hydration very important, and use of paracetamol to control fever. We know normally don't like to give NSAIDs or any other medications which will increase the bleeding chance. So just want to make sure that patients don't take all this Nimucilide and Brufen and all those things by themselves. So hydration and monitoring very closely is the most important. Patients always think that food is going to play a major role, but they end up buying all these what do you call it, exotic fruits, and they said kiwi only will happen, and the rates go shoot up in dengue time. So what as doctor community we want to say is all the fruits are good. The papaya is also good, the apple is also good. All mineral and vitamins and all vegetables, if you take in a natural form, would be very good to building up your immunity. It is not that one particular fruit or one leaf you have to stick to. And normally the story goes that when the patient is already better and the platelets are climbing, they go home, and then some relative brings some juice, and after 3 days the platelets go up. They tend to attribute it to that thing, which is natural psychologically. But as of now, a lot of studies, when I was looking for this talk, I went through a lot of studies, but one or two from here, Malaysia, Indonesia, Sri Lanka, but I could not get to the full text of it. But I did come across a good study done, funded by ICMR, published in National Institute of Health by Dr. Padmanabhan, like a total molecular level bench research, hardcore. So the team isolated seven molecules, several compounds from the papaya leaf juice, and then they worked on it, and then they found that the NS2B and NS3, that is the protease complex, which is crucial for the viral replication, and hence it is considered to be a good viral target. The name of that compound is quercetin. Quercetin can help. So after concluding, they thought with their observation, they said that it is a potential molecule to be worked on, quercetin. All the other six did not show much. There was no toxicity, but they concluded that this was a relevant molecule which they found had some antiviral properties, which needs further research and could be used as the track of potential research. There's another study which I came across, was they are using that papaya leaf extract. There's a caripil. I have to take the name because the study was done with caripil. What they found was when you store platelet, it goes bad in 5 to 7 days. They did infuse that caripil in the storage of plasma. So they said that the plasma storage lesion, they call it, decreases. So oxidative stress reduces with the caripil. Now again, this is also a small study. But things are rolling. But we have to really think: is it the right track of research for going papaya leaf only, or we should really focus on development of vaccine and other viral replication targets. But in a nutshell, there is no strong RCT with big numbers to tell us that papaya leaf juice is the solution as advertised in the social media, and people are very gullible and then tend to believe it. Thank you.
One thing more, our main aim is to increase the immunity. Either in the COVID or the dengue, these are the viral disease. We have to increase the immunity. How to fight your body with the virus, any virus. So anything you want to give, main aim, our aim is to increase the immunity. ऐसा तो कोई है नहीं पपाया आपने दिया और एकदम प्लेटलेट बढ़ गई है. It is natural. If you are not giving the papaya, then platelet will go up. What is this? It is the only myth. It has This is no doubt it acts, but it is not magic with the papaya and all that.
There is a complete list to it. When the patient will get adamant to use like aloe vera juice, then comes the kiwi, then comes the goat's milk, then comes the papaya leaves, and invariably they will land into causing more gastritis, kacha tea along with the milk. They will get more.
Vomiting.
डॉक्टर
Yeah.
उसका तो कुछ कर नहीं सकते, उसका we can't do anything.
So
We are helpless.
There is another herb, Tinospora quadrifolia, also known as giloe, which I
Right.
have.
yeah, you have added one more.
Yeah.
Yes.
You will get the many remedies in the, especially in India, more than the cases.
Especially WhatsApp University.
Yeah, Jugaadu, Jadu Tona, so many things are there.
So basically, Dr. Vidya, these are all things which are taken in a natural form, are good for health. They can eat garlic, they can have ginger tea, they can add turmeric in milk. They're absolutely century old rituals and traditions which have a scientific basis.
Yeah.
But to just say that one particular thing is going to cure this is not true, but definitely plays a role in building up immunity if taken is in moderate amounts. I have seen people having gastritis, they're drinking 10 cups of kada every day.
Yeah.
So done in a moderate amount, and people do steaming 10 times, which is actually not a good idea, not proposed by scientific community for COVID. So I think that's the message we want public to get. Thank you.
That's right, ma'am. So, coming back to dengue and COVID-19 co-infection situation, Dr. Arun Chabra, I would request you to talk more about the line of treatment if someone is being diagnosed with dengue and COVID at the same time, and how do healthcare providers are able to distinguish between the two conditions?
Dr. Ruby, very good question. A person is suffering from the COVID-19 and contract the infection of the dengue fever. It becomes so difficult to treat sometimes the patient. As I told you, the both disease doesn't have any treatment, either the COVID-19 or the dengue. You have seen the recent example of our deputy in the internet, the deputy chief minister, Manish Sisodia. He has suffered from the double infection, COVID-19 as well as the dengue. So if there is a bleeding, then you cannot give the heparin and all that. In the COVID, you have to give the anticoagulants. So both treatment are. First of all, if there is a thrombocytopenia, there is no chance you have to infuse the thrombocytosis. If there is any other, if you want to give the anticoagulant, if the COVID infection, then you have to balance the treatment. You have to treat the both the infection, COVID-19 as well as the dengue. It should be in the big hospital with all the facility. If you give the plasma for the COVID-19, then you have to give, no option. If there is a platelet thrombocytopenia, the less reduced platelet, then you have to give the platelet plasmapheresis. So both are treated simultaneously with the precaution, with the expert, with a close observation. Not be okay.
That's right, sir.
Yeah.
Thank you. Thanks a lot. And sir, now I would like to switch to Dr. Prabhat Ranjan. So, what do you have to say about that? Are we really ignoring dengue amidst this pandemic, or is it right to say that it is creating an added pressure on the healthcare system and public health system worldwide, especially Asia?
Okay, see, as long as the ignoring the cases of dengue, the patient coming to the healthcare system, there is a definitive defined way of informing the case. We are informing the cases to the authorities. It is getting informed to the municipality and from the further to the government centers. So all the cases we cannot ignore. As long as the classical form of the disease, the classical dengue fever is there, who is having the mild disease, they gets better at home only, so they may be missed. So as long as ignoring the cases, we cannot afford that. And definitely those patients who needs the admission or hospitalization in the hospitalization and further treatment, they are definitely adding a burden to our existing healthcare system. There is no doubt about it. So definitely we need to be more vocal, we should be more contributory, we need an integrated approach from the public as well as from the government sector also to just decrease the incidence of dengue further and further, and it will need a participative approach only that is going to help us. As far as we during the previous discuss, the earlier panelist said, that best as far as we know is that the reservoir as well as the vector is the Aedes mosquito. So the best is to control the vector and we can win over it very easily. See, whenever we have the extended monsoon season and all, the number of cases goes up. Every 3 to 4 years, we see the outbreak of dengue. So definitely a better public healthcare system should be there in place. And as far as the our healthcare system is there, the adding more and more to it, definitely adding burden to it, especially in our continent.
All
This
right.
is very, very important because in the India, they are they are not reporting the cases. In case of the COVID-19, have you seen every case has been registered under the ICMR? Nobody can get it done without the Aadhaar card. That was the real registry because any patient from the lab they report to the ICMR directly. But in case of dengue, the people are not registering the case to the government. That is the flow in the our health system registry system. But if you register all the cases, then you can get the true data, real data. If you are registered each and every case of the dengue, either it is endemic, pandemic, or the sporadic. It depends upon the registry of the cases.
Okay, that's right, sir. There has been a lot of underreporting. And Dr. Shalini, do you have to say something about the added pressure on the healthcare system during this co-infection era?
Definitely. It is, in COVID, especially after the second wave, it was, well, initially into 2020, it was 2 months of total shutdown, means like total, there was nobody on the road. So 2, 3 months of that, people did not seek any medical attention for whatever reason they had. And after that, people started trickling little bit. And again, after in 2021, after the second wave, people got disproportionately fearful of the fact just to step in the hospital. They thought that they will get COVID. So they have, I mean, I see a lot of diabetes cases. So a lot of people are coming with no treatment or no supervision with the doctor for the last 1 or 2 years, with the sugar ranging in 400s. So to talk about the added stress on the health system, definitely we are seeing the post COVID symptomatology. We are taking care of that. Let it be, I mean, it could be anxiety, it could be post COVID headache, it could be post COVID myalgia. On top of it, lot of cancer prevention tests which people normally do, which we advise, they have not done for last 2 years. So cancer is also coming in advanced stages, so that is adding the stress. High blood pressure, people don't want to go to any place to check their blood pressure. Blood pressure is unfortunately called a silent killer because they don't feel anything. So high blood pressure can just cause stroke, as everybody knows. So people are presenting with strokes. And now, after everything is opened up, some people, literally sometime I have to beg a person, I know that over the phone video consultation you are having a stroke, I said you have to come, but they are afraid of coming to the hospital and doing an MRI. So it is a challenging time for all the doctors. I mean, it's challenging time for the public as well. But my message would be that we should really empathize with the patient, but definitely encourage them to do the tests which need to be done. If you are having a chronic comorbid condition, be it diabetes, blood pressure, heart problem, please see your doctors. It is safe to come in the hospital. You have to wear a mask. And definitely, all the doctors in India are doing a wonderful job, and no, not a single person has quit, not a single hospital has shut down. And I think more power to healthcare workers and people who support them.
Thank you, ma'am. That was a lot of information about tackling the co-infection situation by our experts. And now I would request you all to discuss a little about the new variant, Omicron variant, and give some tips to our viewers. Over to you, Karan Sabra, sir.
No
Dr.
doubt,
Chabra is going to start.
new variant is coming, everybody knows. We were predicting the third wave in the September 2020, either on September or the October. They have gone without any variant, no third wave. So the third wave, how it come? You know, if there's a mutation, then definitely another variant will come. It comes in, I think, South Africa, but we are afraid of that variant. If it comes, then we have to. What is the solution? Only prevention. As Dr. Charlie said, prevention, prevention, prevention. So if you don't do the prevention, definitely you will contract. If people are not wearing the mask, definitely pandemic will come. Then you have to go on only prevention, no vaccine about this variant till date. You have to wait for another 10 months or the 1 year for this variant. So prevention is the only one about the third wave. It is my advice or the suggestion. Prevent from this variant. Dr. Shalini, Dr. Prabhat.
No, I'll let Dr. Prabhat go ahead.
So recently I got to know that Health Ministry at South Africa, they very categorically has said that it is not a South African variant. The only thing we did is that you know that we have advanced medical facilities over here, and we have done the sequencing of it. Already this strain is present in so many countries. People are reporting world over, except India so far, as per our ministry, that so far no Omicron case has variant infected patient has been reported from India. See, one particular the protein which we focus for development of vaccine, in that area there have been found to be having some more than 30 mutations, and still we have to find out whether that helps the virus to break the vaccination barrier or not. As far as the transmissibility and the degree of severity of the disease caused by the Omicron, it is lesser than the Delta, because the Omicron has less transmissibility than the Omicron and causes less severe disease, as reported by the South African only. So let's see. Still, we have to keep our fingers crossed and wait for the further research to come. At least it will take. It's gonna take at least 7 to 10 more days when we come across that whether it is able to break the vaccination barrier or not.
Dr. Prabhat, it doesn't make any difference whether it is South African virus or that was a China virus. The whole world is affected. It doesn't make any difference.
They have very categorically said about this. They have very categorically objected about
skill saving.
South
That is
African
skill saving only, nothing else, I think.
South African virus.
It doesn't make any difference from virus from where it come. All the world is affected with this virus.
Right.
But we have to prevent the things. Basic thing is you increase your immunity and you prevent the disease. And mask is very, very important. Mask is the mask.
So I would like to be. I will talk in a little politically correct manner. I will call it Omicron virus, and not the South African virus. China gets offended when he called China virus. So Omicron virus will stick with the WHO nomenclature. First sentence I would like to say is I think the media has to really be responsible enough to not create a panic, which usually India journalists do, but this time I think the entire world has created a panic. Now, Delta variant was not more deadlier. It was very, very infective. That's why it caused an immense a number of patients got sick at the same time, which kind of caused a strain on the health. We didn't have any beds, that many beds. So it was not more deadly than 2020. Same way, this is a variant. It is not more deadly. First thing, I think everybody in the media should portray the correct information, because just 2 days, 1 day or 2 days, one statement came, and the market crashed. The financial market crashed. So we have to be very careful in what the medical professionals at the higher level, at WHO level, say, because it's going to affect the entire world. And it would be kind of not fair to just ban the flights from one particular, because we know that variant has been found in Germany, in Italy, in Hong Kong. So maybe it is there, but we have not identified it. We are building the capacity to do the genomics. So I think right now the steps being taken are the one to be screen all the international travelers. Contact tracing. We have many people who came out of Mumbai flight from that area. They are tracing them. In Bangalore, we are tracing 125 people who have come from that so-called high-risk countries. So taking adequate precautions in international travel, properly screening international travelers, contact tracing of those travelers, and of course the COVID appropriate behavior. That is number one. Then COVID Omicron. The two questions: is it more deadly? No, we know that. In the initial information, little bit what we have now from the doctors from South Africa who are treating, there are certain reports, they are saying that the usual cough and cold is not there much, but more of a fever and malaise, and not much of a loss of sense of smell. Again, this is initial information at a very initial stage. Another 2 weeks will add to our information. Number two, big question is, number three, a big question is the vaccine going to be effective? As of now, there are no news or information or from any international bodies saying that these vaccines are not effective. They are effective, but how much we will see. Maybe they would be little bit more research is needed, but it is, I not think that we have to, like, it is completely mutated. It is not like that. Some S gene is deleted, and we are, the scientists are working on it. And I think we have developed two vaccines which are doing great. We have gifted other countries with vaccines. So don't worry, India is a self-sufficient, Atmanirbhar country, and we will get to it. And only the Janta and the journalists have to cooperate with the hard work of the medical professionals.
That's right, Dr.
Especially,
Shalini.
Dr. Robia, media, no doubt, media, if they are having the positive attitude regarding to tackle the pandemic, we can tackle the pandemic very well. बिकॉज वो क्या बताते हैं, वहां इतनी लाशें आ गई, इतनी मोर्टिलिटी, उसकी बजाय जितने भी पेशेंट क्योर हो गए उनका इंटरव्यू ले, भाई आपने क्या क्या एक्सपीरियंस किया, अवेयरनेस, जैसे आपने बताया मास्क का, एंकर मास्क को ऐसे करता है, ये क्या पढ़ाएंगे उनको, अच्छी तरह बताएं मास्क कैसे लगानी है, अवेयरनेस ये बताएं, प्लाज्मा बैंक के बारे में बताएं, प्लाज्मा कहाँ मिल रही है, कहाँ बेड खाली है, कहाँ ऑक्सीजन मिल रही है, ये चीजें मीडिया बताएं पब्लिक को, तो वो ज्यादा हमारे को हेल्प करेगी, रादर देन नेगेटिव चीज दिखा के अनरेस्ट बढ़ता है पब्लिक में और डॉक्टर्स में, और जितना वायलेंस होता है इसलिए होता है। दूसरा, मैं एक रिक्वेस्ट करना चाहूंगा अपने ऑनरेबल प्राइम मिनिस्टर से, मन की बात में ये कहें कि हेल्थ वर्कर के अगेंस्ट ये वायलेंस नहीं करें, क्यों वायलेंस करने के बाद आपकी जो काम करने की क्षमता है ना वो कम हो जाती है। Am I right, Dr. Charlie, Dr. Prabhat?
Absolutely.
Dr. Rubia?
It doesn't have to be physical violence or verbal abuse
अगर
also.
एक बार डॉक्टर ये अपने ऑनरेबल प्राइम मिनिस्टर मन की बात में कह दें कि डॉक्टरों के खिलाफ वायलेंस नहीं करें, आपको बिल की जरूरत ही नहीं पड़ेगी। Am I
That's
right?
true. That's true, sir.
तो
And
ये चीज मैं
thanks a
मैसेज
lot
देना चाहूंगा
to all of
गवर्नमेंट
you.
मीडिया को थ्रू दिस प्रोग्राम, ये होना चाहिए, और मीडिया को हमेशा पॉजिटिव अप्रोच दिखाएं, इससे अनरेस्ट नहीं करें, डॉक्टरों में अनरेस्ट नहीं करें और पेशेंट में नहीं करें, जिससे हमारे जो डिस्टेंस बढ़ जाती है। तो उसको हार्मोनी बढ़ाने के लिए ये मीडिया हमारा साथ दे तो हम बेस्ट सर्विस दे सकते हैं। हमारे पास इंफ्रास्ट्रक्चर बहुत कम है, उसी इंफ्रास्ट्रक्चर से हमने काम करना है। आधा गिलास पानी है तो उससे काम चलाएं, रादर देन कि हम कहें कि आधा गिलास पानी क्यों नहीं है। जितने हमारे पास इंफ्रास्ट्रक्चर से काम करके अच्छी सर्विस देंगे, और हम डॉक्टर बड़े अच्छे हैं और पेशेंट भी अच्छे हैं, लेकिन जो थर्ड पार्टी आती है, मीडिया पर आते हैं, ये हमारे में आपस में डिस्टेंस करते हैं। तो बी केयरफुल अबाउट दिस। These are also tackle how to tackle the
Thank you,
dengue.
Dr. RM Chabra. So I would like to close this amazing discussion by our amazing speakers. And as they all mentioned, prevention is the best way to overcome all these situations and the co-infection situation. It's better to be safe than sorry. I would like to sincerely thank all our amazing and experienced speakers for such an informative session, and especially Voice of Healthcare for arranging this insightful session by these amazing healthcare experts. Thank you, all of you. Have a wonderful day ahead.
Thank you.
Thank you.
Everybody stay safe.